Hi, this is Doctor Antolak from thegentlendentist.com in Shelby Township, Michigan. Our phone number is 586-247-3500. We are doing some in-office whitening right now. Nelly's my assistant here, and she's doing some whitening on my other assistant, Nicole. And Nicole's very relaxed. She's listening to some headphones, and Nelly is going through the process right now of preparing the teeth for what's called core whitening. This whitening process it'll take you how long to do this, Nelly?
2 sessions of 20 minutes. 3 sessions of 20 minutes.
So 3 sessions of 20 minutes, so approximately an hour of being in the chair. She'll be here today. We are applying, first of all, she's applying a solution to help desensitize the teeth first. And then, because the core whitening is something that is formulated to be used without a light, it is very effective and it's more gentle than other types of processes. We actually have the ability to do it with a light, but we find that it's a little bit less sensitive with this process that we're doing. Right now, Nicole we've taken a pre-shade of a shade B1, which matches pretty closely here, and we will probably expect to get a color that is quite significantly white after that. She's going to basically be shiny. So we will do that as Nelly continues this process. We'll take a look at it, what it's going to look like when she's done, and we'll kind of assess that.
So Nicole is ready now for the first session of 20 minutes. What we did was I dried all the teeth and I put twice the sensitizer just to make sure for her teeth not to be sensitive. And then I put this green dam. This is to protect the gum tissue of burning because the whitening material is really very strong. What it is like a little syringe with the paste, and once we place it on the gum tissue, we're using special light, and the light hardens the green material. And once this is done, I have to dry all her teeth, and we have a different syringe that contains the bleach material, and I'm placing the gel on each tooth individually. Once this is done, we make sure that saliva is not running and the patient is comfortable. Many times they can listen to their music, or they can watch movie, or some of them they bring their own book to read. So this is Nicole's first session for 20 minutes. Once the timer rings, we're going to remove this gel and we're going to place a new solution, new gel for the second 20 minutes. All right. Okay, now the 20 minutes are gone and the first session is expired, so I'm going to remove this. Nicole, turn this way a little bit so they can see. Is it comfy? Alright, so this is, I already removed the gel, the upper teeth, and now I'm going to remove with this suction the gel. Like I said, the whole procedure is 3 20-minute session. So first time applying the gel, second time it's going to be very soon. But first I have to remove the old gel. And even now, you can see, I'll show you very shortly. Open up a little bit, Nicole. Nicole is great patient. Okay, you know what? This is...
I'll put that shade tablet.
Yeah, I will. And now, this was the preliminary shade for her. It's B1. If we put it right next to the teeth, you can see the difference even in 20 minutes. So we'll see a little bit later.
Yeah, in the next part.
But once we're done with the whitening, we have to wait like a week for the real color to settle. So this is just for the time being. Is it all right? Okay. Okay, Nicole, them is here. Oh, man. Let's help the patient here with the saliva.
You did a fine job, man. Fine job.
Thanks.
Nelly's going ahead and mixing these up. The Kore Whitening works a little differently than some of the other products. This actually requires us to mix two different types of solutions and mix them into each other so that they activate. The one difference with the Kore system is that it uses and how the system works is it's refrigerated, and that's how they preserve it. The reason why makes it less sensitive to hot or cold when you're done is because many of the different whitening products have an acidic pH. In other words, they're acidic. They have a low pH. That low pH is used to preserve the materials. This Kore Whitening is a special product in that it actually uses, it's at a neutral pH, so it doesn't make the teeth sensitive, okay? And it doesn't etch the teeth. A low pH or acidic solution will actually etch the teeth and make them more sensitive. This material is different in that, once again, that it's a neutral pH, so it doesn't make them so sensitive when we're done. And it's preserved by using refrigeration. When they send this product to us, it's done in a styrofoam container on dry ice. The whole process is made sure that it stays cold and very active. Okay, and that's the key to making this a successful material. So we have a number of different products available for whitening, and if you would like to, if you're not happy, let's say you've had some whitening done in the past and you're not happy. Well, I think what's really important is that you have professionals who are really willing to pay attention to the details of how something is to be done. If the details are not followed through, then you're not going to have quite the result. When this procedure is done, it has to be, if there's any shortcuts that are made, then you will not get nearly as nice of a result. You can see from Nicole's example that only after one time her teeth are very whitened, and it's not because they're drying out right now, it's because they're actually getting whitened out. It's not because they're being heated up from a lamp, from a light, it's actually because they're being whitened at this point in time. So we'll see what the results will be like in a little bit. So if there's interest in this, give us a call please at 586-247-3500. Thank you. Good job, Nelly.
Thank you. Thank you.